Trump's love for Mexican Coke, sugar, politics, public health battles. When President Trump recently expressed his fondness for real cane sugar in Coke in the United States, it's likely he was reminiscing about the Coca-Cola of his childhood. More specifically, he may have been referring to the taste of a Mexican Coke, which is the only variant of Coca-Cola available in the U.S. that is sweetened with actual cane sugar instead of high-fructose corn syrup, and it is imported from Mexico. The irony of this situation is hard to overlook. While there are significant barriers like border walls and tariffs in place against Mexico, the Coca-Cola that comes from there enjoys a free pass into the United States. This beverage, cherished by both immigrants and trendsetters, is celebrated for its authentic cane sugar and its nostalgic glass bottle. In a way, it serves as a delicious reminder that our food choices are deeply intertwined with political decisions. Our consumption is influenced by trade policies, agricultural subsidies, and the robustness of our regulatory frameworks. So why is it that Mexican Coca-Cola is sweetened with cane sugar, while its American counterpart relies on high-fructose corn syrup? The answer lies in the economic landscape of the United States, where high-fructose corn syrup is more affordable due to a long-standing history of corn subsidies and tariffs on sugar. Living in Illinois, I am surrounded by vast fields of corn that are primarily grown not for direct consumption, but for processing into products like ethanol, animal feed, and of course, high-fructose corn syrup. In contrast, cane sugar is the standard sweetener in many other countries, which is why Mexican Coke has a distinct taste that many people describe as more genuinely sweet. This soft drink has gained a cult following, symbolizing nostalgia and purity in a market that is often flooded with artificially sweetened products. It also serves as a poignant reminder of how our food systems are shaped by policy decisions rather than just personal preferences. Coca-Cola has been at the center of national debates before. In the early 1900s, the U.S. government took legal action against Coca-Cola under the Pure Food and Drug Act of 1906, accusing the company of misbranding and adulteration. At that time, the beverage contained minimal amounts of coca and cola, which were associated with medicinal benefits, but it had a significant caffeine content. This case eventually reached the Supreme Court in 1914, leading to public scrutiny that compelled the company to cut its caffeine levels by nearly half. More importantly, this legal battle played a crucial role in energizing the movement for food and drug labeling and regulation, contributing to the establishment of the Food and Drug Administration, FDA, and its evidence-based approach to ensuring the safety and efficacy of our food and medications. Fast forward to the present day, and we find ourselves in a vastly different environment. The Trump administration has been actively working to weaken many of the institutions that safeguard our health. Agencies like the National Institutes of Health, the Centers for Disease Control and Prevention, and the FDA have all faced budget cuts, staffing reductions, and political meddling. The American Public Health Association has raised alarms that these rollbacks pose a significant threat to the health and safety of all Americans. In light of these challenges, perhaps we should look to Mexico for inspiration in public health leadership. There, health advocates and regulators have launched educational campaigns and implemented public policies addressing sugar-sweetened beverages, including those Mexican Cokes that are products of a business model exported from the U.S. They have recognized the links between sugary drinks and serious health issues like obesity, type 2 diabetes, and heart disease. Mexico has introduced soda taxes, mandated clearer nutrition labeling, restricted marketing aimed at children, and even banned the sale of sugary drinks in schools. Their approach treats the issue not merely as a matter of personal choice, but as a public health concern. As a historian, I won't take a stance on whether cane sugar is healthier than corn syrup. That's a matter for nutritionists and scientists to debate. However, one thing is clear. A president's personal tastes cannot replace the need for strong public institutions. You cannot effectively regulate a food system through social media posts. Nostalgia alone cannot protect consumers. Policies cannot be crafted through selective targeting of specific products based on narrow agendas and transactional politics. And certainly, a healthier nation cannot be built by dismantling the very agencies responsible for its protection. If we genuinely care about health, we might consider adopting some strategies from Mexico. Ultimately, the discussion isn't just about which Coca-Cola tastes better. It's about which country is taking more significant steps to shield its citizens from the dangers of unchecked sweetness and corporate power. What do you think? Is it time for the U.S. to rethink its approach to public health and food regulation? Share your thoughts in the comments.